I know in some states, a diagnosis of gestational diabetes risks you out of midwifery care, which is entirely unfair.
Yeah.
In some states, that risks you out of a home birth or a birth center birth. In some states, it's only if you require insulin or medication that you may risk out of those options, which is also unfair, by the way, because there's varying degrees of severity of gestational diabetes. Somebody who needs a low dose of metformin or insulin in the evening to control their fasting blood sugar is an entirely different scenario than somebody who needs pretty sizable dose of insulin and plus insulin at every single meal, and their blood sugars are all over the place. They're really challenging to control. I think it's completely unfair that there's rules around that in some places. There's some doctors that will recommend early induction. They may want you to do more growth scans, and if baby is measuring larger, then they might recommend early induction or a C-section. I disagree. I'm very low intervention minded when it comes to pregnancy and birth. And so my goal is always to help reduce the chances of any and all of the interventions so you can have the least interventionist pregnancy and birth and the best outcomes possible. So it does kind of hurt my heart when there are these default responses, especially things related to growth scans.